To other stories, management of the National Service Scheme has suspended its Ashanti Regional Director Alex Opoku-Mensah for verbally abusing a nurse at the Manhyia Government Hospital. In a press statement issued Thursday, it said the suspension is with immediate effect and that added that the decision has been communicated to the embattled director. Now, let me bring you details of this particular statement. The management of the National Service Scheme has suspended the Ashanti Regional Director Alex Opoku-Mensah with immediate effect. It continues to say that the announcement of the suspension was made yesterday at an emergency meeting, the management of the scheme held with Alex Opoku-Mensah. The management decision is to allow further investigation into the alleged verbal assault on a nurse on duty at the Manhyia Government Hospital in Kumasi. Meanwhile, a committee comprising representatives from the National Service Scheme, the Public Services Commission and the Ministry of Education has been set up to investigate the matter and to submit its report to the NSS management within 1 month. Mr. Opoku-Mensah is thus expected to appear before the committee on Monday, December 5, 2022, and this is signed by Ambrose Ntiwa Jr., Acting Director, Corporate Affairs for Management. Meanwhile, my colleague Erastus Asaridonko visited the facility yesterday and spoke with some hospital officials. According to them, the incident, though, has not affected operations. The staff are depressed.
Here at the Manhyia Government Hospital, this is the surgical ward, and this is where the conversation or the communication or the bad blood, call it anyhow, this is where it happened. And so we are told that the NSS boss entered the surgical ward from here. You can see it's a very busy place, lots of nurses attending to patients here and there. You can count about 6 to 7 beds in this room full of patients, another room in here full of patients.
I came here to deliver an item.
So this nurse who followed the phone conversation between the doctor and the nurse has been recounting what actually happened.
She complained that she has called the doctor earlier, but she didn't pick. She called a colleague of hers before she called back. And then when she called, the nurse said, "I've been calling you, but you are not picking." And she said she was at church. And she said, "It's not today, since yesterday, so please come to surgical ward." And then doctor asked, "What am I coming to do there? Why should I come there?" And she said, "But you are a doctor, so come to surgical ward." Out of anger, she cut the call. Nothing went, nobody insulted anybody. So the doctor called back and I received it. And I told the doctor that she should come to surgical ward. This is the issue. There is a drug which she's supposed to delete it because she's the one who entered it. And then she said someone will come and do it for her. That was all.
So the issue about whether she wrote a prescription for a baby with convulsion and all that is not true. This is an adult surgical ward. How is the situation here yourself?
Honestly, everything is calm over here. So, in fact, we are hoping to hear from the house officer, like the doctor in question.
Okay, so she is a doctor. Lots of nurses in here who are currently working. I want to find out from a few of them how they are feeling at the moment.
We are still doing our nursing activities and doing whatever we have to do for our patients. And we are working in harmony. You can even see the doctor around. But then, as we all know, justice delayed is justice denied. We just want justice to prevail. That's what we are looking for.
Where justice means?
Justice means that the man will have to come and do the needful. Yes.
You want an apology from him?
Exactly. That is what we are looking for.
In person?
In person, yeah. And also a written apology as well. Yeah.
But your head office is demanding that from tomorrow, if he doesn't resign, you guys are laying down your tools. Is that what is going to happen here?
Exactly. That is what we are looking for. So we need the needful to be done as soon as possible so that we don't also put our patients at risk. Because we are all going on strike. That is, we are not coming to work if the needful is not done.
Lessons have been learnt by the Manhyia Government Hospital Management. Dr. Kamaruddin Koku Hussein is medical superintendent of the hospital.
We need to give orientation to all new staff, whether the first time that they are in, we should just do that. We shouldn't wait for a whole group to be in before we start. Because as soon as the house officer comes in, he or she starts work. So instead of us waiting, because our plan orientation is supposed to be done next week. So instead of us waiting, we could have done for each one of them who comes in, and then we give them some short orientation before they start work. I think that is the part that we would need to look at, and then we'll take it up. We will not recommend them to be taken away from here. We think this is just an issue that we can handle. So the doctor will continue to work here. The nurse will also continue to work here.
Reporting for Joy News, Erastus Asaredonko, Kumasi.